Celltrion Healthcare today announced that the Brazilian Health Regulatory Agency has granted an emergency use authorization for the company's monoclonal antibody treatment for COVID-19, regdanvimab, for the treatment of adults with mild to moderate COVID-19 who do not require supplemental oxygen and who are at high risk of progression to severe COVID-19. Brazil had the highest number of confirmed cases from COVID-19 in Latin America, with an average of 35,000 cases per day. Since the beginning of the pandemic, at least 1 in 10 residents have been infected, a total of 20,249,176 reported cases. Today's announcement of emergency use authorization for regdanvimab takes us a significant step closer to providing a safe and effective monoclonal antibody treatment against COVID-19. Regdanvimab demonstrated a promising safety, tolerability, antiviral effect, and efficacy profile in its global clinical trial. The use of monoclonal antibodies is an important tool in the fight against COVID-19. We are actively exploring additional authorization in other countries and regions to help COVID-19 patients around the world. Celltrion's global phase 3 data showed regdanvimab significantly reduced the risk of COVID-19 related hospitalization or death by 72%. For patients at high risk of progressing to severe COVID-19 and 70% for all patients. In addition, patients who were treated with regdanvimab reported a significantly shortened time to clinical recovery by at least 4.7 days. In addition, in vitro and in vivo studies demonstrated potency of regdanvimab against multiple variants of concern, including the alpha. The monoclonal antibody regdanvimab also demonstrated strong neutralizing capability against the lambda variant, first identified in Peru in a cell-based pseudo-virus assay study performed by the National Institutes of Health, U.S.